Tonight, there are new questions about how variants of the virus could impact the research. 7 Action News reporter Faraz Javed shows us what researchers are hoping to learn.
At the beginning of 2020, medical experts believed that COVID-19 was only a respiratory disease. But as we dive deeper into the pandemic, researchers are learning more about the virus, including that it's not bound by any rules of engagement.
I don't think anything in history has really compared to what we've seen from this virus. And even the numbers of deaths are astounding.
Dr. Savati Shah from the American Heart Association says one of the biggest reasons why the virus has left health experts perplexed is because of many patients reporting lingering symptoms for months, even years, a condition that's now being called long COVID.
And we don't understand why some people are susceptible to long COVID or what the mechanisms or why long COVID might develop.
And to help figure this all out, the American Heart Association has already started receiving applications for its $10 million research program, which will begin from April. Dr. Shah says investigators will examine the impact of COVID on the heart, blood vessels, and brain.
There was a recent study that was published that suggests that there's over 100 symptoms potentially that might be related to this long COVID.
Patrick and Akeisha Bland say the uncertainty revolving around the virus is frustrating.
We're going to wear a mask forever. That's how I feel like.
Meanwhile, for Sandy Halcom, the new surge is a concern.
Delta came along and they kind of figured that out, and then boom, here comes Omicron, which is, it's not as deadly, but it infects you 3-4 times quicker.
Dr. Shah, are you worried about new variants impacting the research?
It's very likely that regardless of the variant, that there are going to be a significant number of patients who suffer from long COVID, and it's not going to be related to the specific variant, but instead to what we know about how all the different variants work in the body.
Now, as Omicron continues to surge across the U.S. and here in Michigan, Dr. Shah says the vaccine and the booster are still the best bet against the virus. Reporting in Southfield, Faraz Javed, 7 Action News.